So I've been doing physical therapy for 17 years. I'm an expert in the field, and I am currently telling everybody not to do the things that I have done in my career with patients. And let's talk about neck pain. And a lot of people out there have chronic neck pain, and the typical treatment is to stretch your neck, to do some of these upper trap, levator, sternocleidomastoid scaling stretches, right? And they really don't work. And why? It's because your neck doesn't need to be stretched, it needs to be strengthened, it needs to be contracted, and then you need to move your spine in the range that it hasn't moved in a while, which is typically up. But a lot of treatments out there fail to do this. And then they try to make you feel good with those feel-good treatments, which is your hot pack, your TENS, your ultrasound, your massage, your trigger point, your taping, your Graston, your dry needling, your cupping, your traction. All of these I've done in my career. I've done a lot in my career, either to myself or to my patients for years, and I just wasn't seeing the results. And I'm sitting there thinking, why? I have all these certifications, I have all this knowledge, I have all this training, and I'm still not getting results. And finally, when I started saying, hey, this is just all fluff, this is just all extra, and all you really need is mobility, movement, and then strength, stability in that range. Once I started focusing on this, my patients got better. And these are patients that didn't just have neck pain for a few days, but chronic neck pain for years, decades even, and they weren't responding to the typical treatments. The same things that I was trying to do for patients, they were seeing the same results about it being ineffective. And that's where my program comes from. My program is a simple, logical, but effective 4-week program that expects results because it works on the literal foundation of your neck, your spine, including your thoracic area, which is commonly overlooked in the current medical system. So if you're out there and you've seen what I've seen, that these treatments, they really don't help, or they just provide temporary relief, and now you don't know what to do, there's something different. There's a different, simple approach that will work. So if you want this, go to thespinaltruth.com, look for my neck course. Don't give up on getting relief. It's out there, and it's very likely only 4 weeks away.